Thank you so much for being. My name is Evan Verplu, and I'm with the International Relations Council. I'm the Executive Director. Thank you so much for joining us tonight for what we believe will be an insightful conversation about location connections to the Ukraine, specifically the medical response on the ground to help civilians, led by Global Care Force, an organization based here in the Kansas City area. I just want to let you all know a little bit more about the International Relations Council. We're a nonprofit based here in Kansas City. We've existed for 70 years with the mission of increasing global awareness and civic engagement around world events. that manifests with educational lectures, discussion groups, youth programming, all that serve that mission. A couple things that we have coming up are really always ongoing are Monday roundtables, which happen. There are 7 different regions of the world that we've broken them down into, and they run on Mondays from 6:30 to 7:30. These are informal ways to come and discuss current events and global issues. We exist in a society that information and discussion is commonly done through the internet and on screens, so it's always wonderful to have the opportunity to get together and discuss these issues face to face. Where you can really find a lot more common ground than you might otherwise feel that you do on the internet. On Monday, November 10th, if you work for an organization, if you're part of an organization, if you have a student in high school, we very much encourage them to learn more about Your Global Future, which is a college and career fair. It usually brings about 800 to 1,000 high school students from area schools around the metro to talk to businesses, colleges, organizations that have an international presence. So if there's a student out there that wants to live or work overseas, this is a wonderful opportunity to learn more about the opportunities that they have to do so. And then we also have our IRC Book Club, our next one will be on Tuesday, December 9th. And that book will be How Soccer Explains the World by Franklin Ford. So I encourage you, if you're interested in that, if you're interested in joining a book club that talks specifically about international nonfiction and fiction books, we very much encourage you to join that. So now I'd like to introduce our panel and moderator for this evening. On our panel, we have Roxanne Jones, who is the Vice President of Global Programs at Global Care Force. We have our special guest, Dr. Lev Prystupiuk, who's Global Care Force's Medical Director in Ukraine. Dr. Prystupiuk has traveled from Kyiv to the US as part of the Global Care Force Healing Hands for Ukraine tour, which will also take him to Denver, Phoenix, and Washington, D.C. And before we move any further, I'd like to turn it over to Elizabeth Alex, who's the Executive Director of the University Relations at Kansas City University and board member of Global Care Force.
Thank you, Evan. Thank you. First, I want to just thank everybody for coming, and thank you to the International Relations Council. I just want to say I've been a fan for a long time, followed your work, and I think I looked at those roundtables online today, and I thought that sounds pretty cool. So you may see me and my husband in one of those.
Please.
A little bit about me. I had a long career in television news here in Kansas City, and for a while now I have been in the space of marketing and public relations and telling the story of Kansas City University. I also have worked with refugees from the Ukraine war at a home in Romania that my husband and I own since the war began. And the stories, these people are beautiful. These children, the mothers who have fled while their husbands stayed behind to fight, and grandparents who didn't want to leave. And then it's really a pleasure to be part of Global Care Force as you guys are treating the people, the patients, working with the people who did not leave, who are having to stay behind. It's really pretty wonderful thing. So I want to start off with you, Roxanne. Tell us a little bit about your history and how you got to get Global Care Force and your background in Ukraine.
Well, I guess my background in Ukraine goes to 1995 when I went as a volunteer through a church organization, and then later I went for 5 years in the church organization and did this kind of work then. So when the war broke out in February 22, Dr. Morris and I had known each other from past events, and he reached out and said, would you be interested in helping us send teams to Ukraine? And so I agreed, and that's really how it started. So I started in July of 22, but Dr. Morris had made several trips into Ukraine and Poland, the Prior to that, Lev and his brother, who's also a physician, had reached out, needing medications and some wound vacs and things like that. And Dr. Morse was able to supply. Lev will talk about it. Maxime, his brother, is a plastic surgeon. And so he's heavily involved in the treatment of the soldiers and so forth. And so that's how it began. And so our first team deployed in September of 2022. I was on that team and setting up our program that we have now. It's our flagship program, even though we're working in other parts of the world, everything's formed around what we do in Ukraine. And so our teams are provide primary care to those individuals who live in deoccupied areas. These are areas that Russia controlled for anywhere from 8 to 14 months. It's still heavily mined, which we'll talk about some things later. But that's where we go. We work with the local health department in the certain area that we go in Mykolaiv. And we provide continuity of care, which is pretty rare, meaning we go back to the same places every month, every 2 months, and provide free consultations and free medications.
These are people who are in previously occupied areas, so there's probably a bit of trauma there as well for everyone in Ukraine, but
Lots
especially
of
trauma
trauma.
areas. Dr. Lev, I'm not confident enough to say your last name yet. I will. Tell me, what was life like in Ukraine before the war started? I mean, and was it a surprise to you that this happened or to others?
It's fine. Yeah. Thank you very much. We are a very peaceful country, and before war started, we were thought to be part of European Union, and actually why we was stay on this that we want to be firstly part of European Union. We want to be part of NATO, and we want to be actually totally independent from Russia. We don't want that our considered like post-Soviet country. That we Ukraine is a huge history. That Kyiv, we know that in which year was found Kyiv. Kyiv was founded in 456. 400. Kyiv was a capital of Kyiv Rus. Russia even still our name of our country because Kyiv Rus was baptized in 988. And since all of the time we was Ukrainian. Yeah. Then it was a lot of period was happening that we was under Poland, Austria, Hungary. It was First World War. That actually you have amazing museum. And if you didn't visit it yet, strongly advise you, please visit. Is the iconic place in Kazakhstan. And then we had World War II, Holodomor, and we understood we don't want to be related to anything. And the past 35 years, it was independent, and it was peaceful life. And actually, when we have cautions, even from President Biden, says that Russia will attack you and it will be a war, even we did not believe it then. When it was, I clearly remember that it was in February. And then even we don't think about that, that even unfortunately in 2014, Russia occupied took it, Crimea, Lugansk, Donetsk. But even we couldn't think that in 2022, they will be take over whole Ukraine. And in February 2022, it was February 24th, when they started to heavy shield all Ukrainian cities, all of airports was shielded by ballistics, cruise missiles, any kinds of missiles what you could imagine that was a shield. And even we couldn't imagine that it's terrible. The first thing that we thought that it would be a couple of months. Then we was believe that it will be finished in 6 months. That in 1 year, we very truly believe that it will be finished in 2024. But unfortunately, the situation is going. And coming back to your question, we was very, and we are a peaceful country. We don't want any other territory. We had a lot of history, but we didn't find with Poland, Belarus, or Hungary. Yeah, it was everything past. Right now, it's reality, and then we don't want back to this empire idea or something like that.
How did you go for, well, you were a doctor in Kyiv at the time, the war started.
Yes, I am.
And you started collecting medical supplies to help with the effort, and to help the citizens. How did it go from collecting medical supplies to then collecting volunteers, many of them from Global Care Force, and bringing them over?
I was immediately contacted in February 2022 with Dr. Gary Morsh. Before it was Global Care Force, it was heart to heart, and Dr. Gary Morsh already worked in Ukraine, and Gary Morsh worked with my parents. It's in early 90s. It was 1992 when they provide supplies to Ukraine because my parents, mother and father, the physicians also them.
So Gary knew your parents in
Yes.
the 1990s.
Yeah, in the
I didn't know
1990s.
that. Well, but he does have a long tail, doesn't he?
Yes, it was heart to heart, and he even remember how it's a huge plane. It was one of the biggest plane. There was shipped medical supplies, and at that time we understood, as Roxanne already mentioned, myself, me, my sister, mother, because unfortunately my dad passed away in 2016 due to cancer. We working clinics as my brother's plastic surgery, he's a vascular surgery. We understood that at that time, the crucial one that we understood, it was lack to wound wax. Wound wax is a special machine that helps to save extremities. Extremities as legs and arms. So due to the wounds, it could be either like shrapnels or tourniquets, and it's actually a very good technology. It's very common here in the States. The device costs like about $10,000, but here in States you use one device for one person, and you this disposable. We say no, we will not do this, and we use it once for up to 100 people. And this we talk with very much. We use wax machine for helping soldiers for the wound care and all other supplies. Because Kyiv was one of the major station of evacuation. It's go from east. They go the first one. It was Kharkiv, Poltava, Dnipro, then Kyiv, and then we sent it to west. And then we started incorporated not in Kyiv. We started incorporated also with, as already mentioned, Kharkiv hospitals, Dnipro hospital, and Poltava hospital.
Well, I got myself in a little trouble here because I was supposed to start with the video, and I was so excited to talk to you guys that I didn't call for it. So let's play it now. It's a gentleman named Jeremy Hubbard is a journalist in Denver, and he actually was here at Channel, I believe he was at Channel 9, wasn't he here? And now he's in Denver. He went to Ukraine and brought back the story of many people in the effort of Global Care Force. So can we play that, Brenda?
You could see that it was jets on the 5 positions. Here, it was air raid, and then potentially could launch ballistic missiles.
The threat is nonstop. Hundreds of bombs and missiles and drones raining down on Ukraine daily.
We'll know in a couple hours, we'll know the situations if you have any damage.
If Dr. Lev Prystupiuk seems unfazed, he's used to this. What is that?
You heard right now is that air defense systems are trying to shoot drones.
What did it sound like? This is just another day in the life.
Вітаємо. Ми зараз довадаємо.
And he can't let the threat of attack stop him. There's too much to do. Dr. Lev is medical director for Global Care Force, coordinating workers and volunteers as they set up clinics to help the most vulnerable Ukrainians who've been displaced by war. People like this young mother who fled some of the heaviest fighting with her baby in tow.
And when we cross this road, it was a heavy shelling starting, and the people are dying and killed by shooting by any kinds of machine.
Refugees whose lives have been forever disrupted. He's always looking out for his fellow countrymen.
He go out from car and started moving to a forest, but the enemies started shooting to them, and one of the bullet was
his back here.
making sure they're not forgotten. And he does it all right here under the constant threat of attack.
Besides the healing a body, the healing their souls.
While also caring for his own family at home, trying to navigate life in their homeland ravaged by years of war.
It was one of the heavy rocket attacks over Ukraine, and one of the rockets by proposed was launched and hit here. Could you imagine if you would be one of these rooms that it was completely destroyed?
His positivity, his resolve to help the people of Ukraine is one of the reasons so many Global Care Force volunteers keep coming back.
Yes, it's very important when teams from America are coming here because the people, they see they're not forgotten. They see that America provides help to them, and they was receiving this help.
He shows everyone involved what having a servant heart is really all about. Always looking out for those who need help.
Well, Roxanne, seeing the faces of the people there in those clinics, some of them looked absolutely exhausted, like they just can't go another step. Is that what you found when you were there? It looks like towards the end of this video, though, they did feel like you did get the sense that these people were feeling like, okay, there's somebody who cares out there.
Yeah, I think aside from the physical care we provide an emotional care by we touch them, we hug them, we smile, we cry with them, we laugh with them, and they always are saying, we're not forgotten. Thank you. We thought we were forgotten, and you have brought us hope and comfort, and we promise to go back, and we do. And we've done this now 31 times. Our 32nd team left yesterday from the States and arrived in Krakow today, and they'll be in Kyiv by Thursday morning. And so I've gone 16 times myself. I went the first 9 months, and then I've been back 7 more times to just make sure everything's running smoothly and just provide some support. I'm a nurse, by the way, so I can jump in and help if needed. But they're so tired. They're just so tired. But their resilience is amazing. Did you want me to tell a couple of stories now, or do you want to wait for that? We have some wonderful volunteers that have gone, and now some have gone 4 times, 5 times. They just fall in love with the Ukrainian people because you always get so much more back when you give. It's not, you don't give to get, but that's just the way it is. But one day, a lady, a babushka grandma, came in, and one of my doctors, Dr. Marilyn, was seeing her, and the lady was complaining of back pain. And Dr. Marilyn said, well, why do you think your back's hurting? Has something happened? And she said, well, I've been digging a lot of graves for the military. This was an elderly lady. And Dr. Marilyn was able to help her. And Dr. Marilyn's husband was there along with her one day as well. And he's a rheumatologist, a retired rheumatologist. And in the villages, you either walk, you ride a bike, maybe there might be 1 or 2 people that have a car, but it's, the bike or walking is how you get around. And a lady had arrived, again, an older lady, babushka grandma, and she was complaining of knee pain. And Dr. Guy is the pain god. I mean, he relieves so much pain. He's given so many steroid injections, and he injected her knees that day. And she immediately felt relief. I mean, she stood up and grabbed him and kissed him. I mean, she was so happy. And she said, don't tell your wife I kissed you. And of course, Marilyn didn't care. And then she immediately went outside and got on her bike and rode away pain-free. And when they know Dr. Guy's coming, I mean, they line up anyway when we come because they always know we're coming. But they love him because he brings such relief. And then just a last story, and I always tell this one because I don't know if I'll ever stop seeing what I saw, but a little girl about 3 arrived at one of our clinics, and come to find out it was her great aunt who brought her in. And this little girl was just beautiful, little tiny thing, and just stoic. I mean, just no emotion, and eyes, just huge eyes. And what we heard that day, just one of our Ukrainian staff just had to get up and walk away. He started to cry immediately. But a few months earlier, the Russians were coming. They were notified the Russians were coming to the village we were in. And so this mother had 3 children, and family members got the 2 older kids out, but they didn't get back in time to get the mother and the 3-year-old before the Russians took over the village. And this little girl ended up seeing her mother repeatedly raped by the soldiers, and then they hit the little girl in the head with the butt of the rifle and threw her into a pit. And a few days later, they found her because this great aunt and other family members were rushing back to the village when the Russians left to try to find him, and they did. But this little girl has not talked since then. And of course, the mother's receiving mental health services. She's unable to care for her family. So this is just 3 stories. I mean, there's so many stories.
Well, I think those stories bring it to life. You know, we can help on a big scale, but it's those one-on-one things that, you know, help us get to know the real story of what's happening. Dr. Lev, you're going to the same places. Why is that important, this continuity of keep going to the same places? Because there may be other places that would want to have you come there too.
For the last 4 years, I couldn't say that we go for the same place. We go for the same place for some period when we are waiting and helping Ukrainian authorities, local authorities to establish healthcare system. And actually, one of the examples I would like to say, here we have folks from Ukraine and that we're chatting, and one of them from Kherson. And the war was started, may share the story. Her dad was died due to the reason that it was not provided medical care. Yeah, unfortunately, he passed away. Yeah, we just share this story. And after that, we just explained where we are working, in which area. And one of the village where one of the relatives lives is at Tamarino. Tamarino is the latest village in the border, like is a property of Ukraine. After this village, it's Russians. And it's not. And we just share right now, in nowadays, it's no access to there. Because this village was under occupation, exactly one village, yeah, was under occupation about 14 months. And Russians destroyed everything there, literally. It was completely destroyed village. Right now, our government tried to build, and we see it's a good road, bridges, because all the bridges was blew up by Russian side and also by Ukrainians as a defendants, the defense. You understand? Yes, to defend our land. Yeah, they will. And government and all the resources go for roads, bridges. It's no water supplies. It's no heating, and most crucial, no electricity. Yeah, it's working on these main things. And it's right now it's good that the buildings are renovated. And wasn't Jeremy shows on the video he took in one of the clinic. But you see, you maybe see that it's right now it was renovated. Yeah, you see that it could be renovated, but it's no people there because people are either killed on these villages, or they are still on the prison in Russia side, or they are drafted because all our health, even me, I'm on military service also at this time. Yes, all of us are drafted as a healthcare professionals, literally no people there. And when we started with Roxanne since 2022 in September, we were starting literally in location. It was the occupied areas of Kyiv region in border with Belarus. Then we moved and we helping there. And when is established, like authorities fix everything with healthcare, we moved to Vinnytsia region, Cherkasy, Odessa, Kharkiv. We work a lot in Kharkiv region, but right now Kharkiv, unfortunately, is trying to take it back its heavy shillings. In two places where we have been working, it's Russians by propose fully destroyed rocket. It was a rocket that destroyed two facilities where we operated. Yeah, for safety reasons of our team and the people who we provided care. We are right now limited. We limited on providing care in Kharkiv region. Right now we are operated. It is the Mykolaiv and Kherson region is a south and east part of Ukraine. Actually, it's literally on the about 10-20 miles from front line. And continue. This means that we're a little bit moving during these 4 years, but we have commitment to these people with who we provided care and with the local authorities that we define the villages where it was recently deoccupied, where they started to establish, renovated all of the infrastructure. People coming back are still there. And we agree that we will continuously provide them because we're not a pop-up clinic. We are providing primary care in very nutshells to explain you what's mean primary care. That we come to the clinics, that first of all, we have nurses, we do trash, we do blood pressure, we do blood examples like blood, we took urine, we do all of this analysis. Then we send it to our physicians providers. We provide a comprehensive, and it could be in mobile clinics, examination included, ultrasound, ECG is needed, and all of the deep examination. And then the patient, if we started trauma care, send to our trauma care specialist, and then we send it to pharmacy. We are providing medication at least for 1 to 3 months. And we know and our commitment that we will back on this location every other second or third month to see the progress because the people are affected. There was under occupation that has huge stress, continuous stress here, and all of this blood pressure, diabetes, anxiety, chronic pains is due to huge stress.
And if you have high blood pressure or diabetes, you can't just take your medication a couple of days or a month and then forget about it. You have to have that continuity.
Yes, and you're correctly right. You need to be continually. And in this village where we operated, for example, like tomorrow, back into our Fox, it's no way to get medication. Literally no way. It's no pharmacy, it's no grocery store. For them to go to the nearest pharmacy, they need to drive literally 2 hours. And it's not public transportation, nothing. And we just want to make sure to provide, because one of our idea to bring, and we bring it not just with treating the body, we bring hope, joy, love to these people. Just really take a hand and to listen to these people is the most important and most crucial. And of course, if you talk about the chronic disease with patients, what we are working, we need to make sure they will have this continuous medication. And we try, it is like a story of one family, yes. We want to help, and we are helping to one people. And all of you could just help to one people, but this providing help to one people could change significantly situations in whole community, because this will be impact a family, and family will be impacted as a community.
I want to get to how you can help in a minute, but I do want to ask you, Dr. Lev. I mean, you were a doctor in Ukraine. Your life was on one trajectory, and as you said, this was not unexpected. And now you're going a whole different direction. Your life has changed probably forever. How do you deal with all the things that you've seen? And I know doctors are clinical and you're tough guys, but it's got to, on some level, it impact you. And I'd like to know how it does affect you.
personally, me, of course, it's very hard. Because when you see one of them as a story, just want to show you that it would reflect what we're feeling. That we arrived to village and heard this story that 2 weeks before that the lady that could come to us, that she started crying, and we found out that her son was standing in front of her. She was, he's 30 years old, and it was somewhere, rocket was blowing up, and the shrapnel, one piece of the rocket was go and tapped the head, and she literally see how the head was taken from his shoulders, was going to his hand, and she all these terrible scenes, and she was together with her husband, and she will be live this forever. And when you heard it,
Imagine.
yeah, you are crying seriously, but you should be strong. And the situation was the worst situation is coming. That the war is continuous, and of course you should be strong enough. You shouldn't be worn out. But all of this situation, you know that you're literally exhausted. Especially during nights, during all of this, you not when it's funny thing when they say how you're hearing this is a defense system, but during night you are sleeping, but you couldn't sleep because you have you heard how the drone is flying. You literally heard how the ballistic missiles are flying, and you heard these machine guns how it could be they try to shut it down. And the most what I don't like it at all, the crucial one that killed you, is when you hearing the rockets. At first you hearing the noise, then you hearing the blow up, and the most terrible when you feel shockwave. It's like personally in my house, I already twice changed windows.
Change your windows.
Yeah, and literally in my house, even have piece of rockets that go through the wall.
Well, I hope you're taking care of yourself physically and mentally, because obviously we need you. Roxanne, you experienced some of these things too, and a lot of people here in Kansas City and around the country they're willing to go help. They'll go into this. Tell me how you get people to go, and what the process is, and what's needed.
Sure. We have, of course, we recruit online. We have a website. Right now, our volunteers are saying, well, the first question we ask when they interview is, how did you hear about us? And they say Google. They'll see us on Google. When you put in Ukraine Medical, our organization pops up. We're the only organization doing what we do in Ukraine. Everybody else has left, or they've hired locals. And the local practitioners, they may go and just get a list of people. Maybe a group drops by once in a while and gives a medication, or only just the prescription. But no group is there doing what we do. And we intend to stay there till it's stabilized, even when the war starts. So once a volunteer applies, you can go to the link on our website and click volunteer. And once we automatically get that application, we set up an interview. We vet everybody. And once they are interviewed, we review the notes and say yes or no. Most of the time, yes, but we've had to say no for some. They give us references. And once we clear all that, we get them set up on a team. Our teams are around 5 people, 3 providers, which are doctors, MDs, DOs, physician assistant nurse practitioners. Then we like to take 2 nurses or EMTs, paramedics, and of course a triage person is a trauma counselor, a psychiatrist, or something like that. And then they're onboarded, which means they have to give us documents like their passport, their license, fill out forms, waivers, things like that. And then they raise $6,500 to go with us. And that $6,500 is all inclusive, including airfare. All they have to do is get on the plane and arrive Krakow on a certain day, which we set up. One of our staff, Luba is her name, takes 2 trains every month to Krakow, picks up the team literally at the airport because they don't know each other. Most of the time, they come from all over the world, actually, mostly US, but outside the US as well. They overnight Krakow, she then takes them by train back to Ukraine. So they're not alone at all. And once they hit Krakow, all they need money for is souvenirs or snacks. Everything is paid for at that point. All the logistics are covered. I'm kind of type A. I don't know if I like everything exactly, completed. And Lev and I work together. We're emailing back and forth all the time. And hotels are set up, food is set up, transportation set up. Every person gets their own counselor, translator, not counselor, translator for the entire time. And that translator not only translates for them during the clinic, but also at mealtime, helping them read the menu so they can order. And they leave they feel like they're leaving family when they leave. They really become attached to each other. We have communication going on Telegram, and they continue to send notes to each other because it pops up on whoever's on the group. And I've never had anybody who said they'd never go back. And now we literally have people going back for the 4th and 5th time. And one in particular, I will tell you, she's in Denver. She doesn't even own a car. She lives downtown Denver. She's a trauma care specialist. And I don't know how she does it on her meager income. But that lady raises that amount at least 2 to 3 times a year. She's leaving again in the spring for her 5th trip. I mean, she's addicted to Ukraine. But I am too. I always say I'm half Ukrainian, half American. My best friends are in Ukraine. But Dr. Lev and his team there do a great job. He either leads a team or another physician, and all but one of the translators are physicians, which is amazing. So they are helpful to our providers because patients come in and say they're on this and this, and they can help translate that for the doctor to help them to understand. We carry our entire pharmacy with us. I buy anywhere from $5,000 to $10,000 of medicines a month. We get them from a hospital in Kyiv. And we give that list of medications to the doctors so they know exactly what we have. And they're the most common medications that are necessary. But we buy them in Kyiv because we want to boost the economy. We want to provide patients with medications they understand. Many times when you take US medicines and try to give them to someone outside the US, they think you're poisoning them or something like that. So these are medications, they can read the label, they can read the instructions. Of course, they're given all that information. And then, if they needed a packet before we get back or something like that, maybe somebody could help them, find some. But otherwise, we're back the next month. So we have records on everybody. Some patients, like I said, this is team 32. And so we have patients that have been seen a lot. I recognize faces. They recognize our faces. And they're very comfortable with us because we've kept our word, because we do go back. Yeah.
No, I would like to hear all of it. And I think since I work at an osteopathic medical school, I'm glad you mentioned the DF. So I'd be very happy to hear that. So tell me a little bit about the kind of medicine that you need on a daily basis. And it seems like it would be good that you're purchasing the medications in the country, just help the local economy on some level. And also the idea that, when there's a lot of aid that's given and people in the United States and around the world want to help, but this sounds like it's a real partnership and that the people who are doing the giving are getting more than the people who are receiving almost in some ways. I asked you 2 questions there basically, but we'll start with what are the most important things that you need medication-wise?
Yeah, its medication, as Roxanne mentioned, is up to $10,000 we purchase medication, as you correctly write, that we are supporting Ukrainian economy, we supporting Ukrainian pharmacy production, and for people, it would be very good when they receive it, the medication, they could see read label and they know it's about this medication. But besides this, when we give a prescription, when we give recommendation to each of the patients, we put also, of course, our label, how many times and when you need to take it. Yes, we just make sure that the patient will be compliant to us. We have actually essential medical list according to WHO World Health Organization, and we cover the whole needs. As Roxanne mentioned, we bring it as whole pharmacy. We have both OTC medication and prescription medication, RX medications, and we actually started from antibiotics. We finished with some vitamins, but the most crucial medication for us is for hypertension medication, the crucial one. Then the second one, it would be pain relief medication, especially arthritis cream. It's extremely, then is a hemorrhage cream. Then it would be a diabetes medication. We have different types. We have also problem with ulcers, stomach pain, gastritis, all of this medication we provided. Also, we provided inhalers because quite often, and they're quite expensive inhalers. Also, we provided all the medications. It was for free, in a sense, with our volunteers. We provide medication also for if it's we see for anxiety, if it's needed for insomnia, anti-allergy. We have.
I would expect there's a lot of insomnia and anxiety there right now, for sure.
Oh.
Yeah, for sure. And now I have more questions, but do any of you have questions that you'd like to ask of our guests here?
You might have mentioned it. How long are the stints with the volunteers?
2 weeks.
Just 2 weeks.
2 weeks,
Yeah,
yes.
2 weeks every month.
Can you stay longer if you want to, or is it, this is the deal?
Not
2
when
weeks?
they're global purpose. You're welcome. Some people go early to Krakow and stay late in Krakow or something like that.
Just enjoy, Eastern Europe, but the team itself is 2 weeks.
We had some of the situation where the people agreed to stay. For example, they want to stick to some of the hospitals, but as Roxanne mentioned, if they will be not under global force. For example, we finished on our last day when the team departed to Krakow. If the person wants to stay, but it would be up to him, he could stay, and we have a lot of, not a lot, but some of them are staying, but they on his own.
Do you have any other questions? Well, I'm curious.
We talked about, again, like some of these stories that are so moving and heartbreaking, and we talk about mental health, behavioral health. Are you able to offer anything along those lines?
We do have some medications in our formulary, and also trauma care has really taken off in Ukraine, and there's a lot of trauma care programs now. And so they can refer them to certain programs. They also have helpful handouts with them and go through some practices that patient can practice on their own at home to help them relax and decompress and things like that.
Yes, I just want to add, if we have trauma care specialists in our Ukraine team, we have 3 psychiatrists, and one of these psychiatrists will be a translator for trauma care. During trauma care, they doing what Roxanne mentioned, this breathing, how to calm down, the cooling part they're using, how they explain you how they could draw, about using the toys. But if what Roxanne mentioned, our specialists, we could immediately in our clinic refer them if it's needed to more deeply psychiatry institution or to refer to local program that established. But even when we communicated with authorities and different organizations, trauma care is the most crucial point right now. And actually right now, even from Red Cross, our last communication, even they ask us if we as Global Care Force could provide for Red Cross TOT, train the trainer, the workshop, how they could use models and to share our models.
Right, so next year, we want to put together a trauma care team to go and do a train the trainer program in Kyiv, or not in Kyiv, but in Mykolaiv. Because since everyone has found out about us in Ukraine, they're coming to us. Can you help us? Can you do this? Can you do that? And sometimes we say, no, that's not our specialty. And we're upfront and honest. Some people say, oh, I just want to jump in and join you, and that doesn't work either, because we have set dates, we have set locations, and somebody coming and going, or we need assistance financially to pay for all that. And so somebody just to jump in and join us doesn't work. And they don't understand our processes. So there's a lot of people doing a lot of good things.
Well, I want to ask this, if you can't go to Ukraine, what can you do to help? I know that this is not cheap what you're doing, and there's a lot of fundraising that's needed. Tell us about that and anything else that people could do to help.
You know, our biggest expense is medications every month. And unfortunately, a lot of organizations don't want to give grants for medications. But that's what we need most. And if we could have some folks that all they did was raise money for medications, that would be incredible. We give anywhere from $30 to $50 per patient a month. And you know, you could explain it like that. You're helping one grandma, you're helping one grandpa, or giving antibiotics to this child who came in with a upper respiratory issue, or inhalers to this poor little child who has these inhalers. It's just amazing how much that helps them. And it's nice now that after over 3 years, we started our 4th year in September. Our volunteers have traveled over 1 million miles just this year. We travel 2,000 kilometers within Ukraine every month, but that doesn't count the miles that they flew on 3 planes and then 2 trains to get into Kyiv. We've had, like I said, a total of 34 teams because we work in Jordan and Egypt as well. We've spent over $300,000 on medications since 2022. We've seen over almost 12,000 patients, which boggles my mind. Had 152 volunteers and over 263 staff persons that have helped us do this program. It is a team effort. But we believe it's being done correctly and helpful, and we see that by the results of blood pressures coming down, blood sugar stabilizing. People are starting to sleep a little bit better, maybe have a little less PTSD because they know somebody cares, somebody's going to be back to listen to them. We need people on the team just who will sit and listen and write stories for us and take pictures. You don't have to be medical to go with us. In fact, next month I have 2 non-medical people on that team. There's work to do. But if you're interested, you know, if you can't go, maybe you'd support somebody who wants to go but doesn't have the finances to go. And we would love to have that money available to say, hey, we know you're in school, you can only pay so much, but there's a person who's gifted us some money to help someone who can't afford the $6,500 or so forth.
That's great information. Well, I wanted to, yes.
Just to add one thing, that we talked a lot about Ukraine, but you mentioned the medicines. We're also in Jordan and Egypt, so it's not just the 10,000 for Ukraine, it's those other 2 countries as well that were covering.
Yeah, you know, those by the numbers stories are very, they do tell the story.
Yeah.
What do you need for Jordan and Egypt as well?
We're doing the exact same thing in Jordan and Egypt. We see Jordanians, of course, when we're in Jordan, but we see a lot of refugees, Iranians, Iraqis, Syrians, Sudanese, and the same thing in Egypt. We see the less fortunate in Egypt, and then there's huge numbers of Sudanese refugees in Egypt. And we saw over 1,000 patients on our inaugural team, and over 660, I think, in Jordan. Our teams in Ukraine see anywhere from 350 to 400 a month. We do an average of 9 to 10 clinics every month. That means 10 villages. We do 2 in the day because we drive at least an hour and a half, 2 hours to the first village. Then we'll go to a second one in the afternoon. and then come back. So it's very vigorous. I mean, these volunteers work hard and it's a busy, busy schedule.
I think as a donor, it's good to know that there is a process and a protocol and there's a plan, so you know where your money's going and that it's going to good use and not be wasted in any way. Dr. Lev, I just want to ask you one last question of, what do you see the future of like in Ukraine? Do you have any thoughts, hopes, dreams? I'm sure that you do, but I thought I'd ask you that to kind of close my question.
Our hope and dream when as soon as possible war will over. So first what we want the war will over and we want peace and we want to live in our land. Yeah, it's what we want. It's most important. And even like tomorrow war will over, it will need a lot of needs, help to Ukraine. And we already scheduled 12 months in 2026 for Ukraine, and we believe the beginning of 2026 war will over, but still we will have a lot of the areas that was occupied, it will be deoccupied, and we need help them, we need people receive this care from us. And my dream and what I see that in near future war will over and we will live in our free land.
Well, I don't suppose you'll go back to just some quiet life as a physician in Kyiv. Sounds like you've charted a new place for yourself in the world.
Yes, Kyiv is a nice place, but it's already mentioned, we have a very nice place and we hope that we will be operated in Donetsk, in Lugansk, in Crimea. By the way, Ukraine is the biggest country within Europe, and what Roxanne mentioned, just only in Ukraine, we drove more than 2,000 kilometers just from Kyiv to all this place. Just on this, and it's not counted that it will be take you 12 hours. The first train will be take you from Kyiv to Krakow, the 12 hours. Then layover, another 3 hours train, and another from 8 to 10 hours flight back to States.
Does anyone else have any questions? Well, thank you everyone for coming and thank you so much for your time. You're going to go a few more places in the United States before you go back, right?
Yes, we will go to tomorrow. We fly to Phoenix and then we go fly to Denver and Washington D.C.
We'll have a chat with some of those people in Washington D.C. Will you please?
We will.
All right, thanks everyone. Thank you, Roxanne, very much.